So this talk is all about the role of expertise in COVID policy. Now, as we all know, expert scientific advice has featured prominently in the COVID-19 pandemic, serving as the basis for policy decisions which have dramatically affected the lives of millions. In the UK, ministers have repeatedly claimed that they are following the science, despite protestations from scientists that there is no unified view to be found in the science and that the decisions are out of their hands. While we should be suspicious of any attempts by the government to pin responsibility for political choices on scientific advisors, we shouldn't take the public statements of scientists at face value either. Although it is ministers who make the final decisions, experts clearly do exert some influence on the decision-making process. My aim in this paper is to determine the nature of this influence in the case of COVID and assess whether it's normatively appropriate. So at this point, I should add a quick caveat. I wrote this paper in autumn of last year, so its findings are limited to the period roughly from March to November of 2020. Now, my feeling is that the critique I make in the paper still holds true at present, but I would be interested to hear if anyone who has conducted research in this area more recently has noticed any significant changes. So in this paper, I focus on the Scientific Advisory Group for Emergencies, or SAGE, as this is the expert body most closely involved in UK COVID policy. Now, for those who don't live in the UK and may not be familiar with SAGE, I'll just provide a quick sketch of what this group does. So according to government documentation, SAGE is responsible for providing Cabinet Office briefing room meetings with coherent, coordinated advice and to interpret complex or uncertain scientific evidence in non-technical language. SAGE encompasses a wide array of expertise deemed relevant to COVID, ranging from epidemiologists, clinicians, and public health experts to environmental scientists, statisticians, genomic experts, and behavioral scientists. Collectively, these experts, along with those in a number of subgroups, represent the primary source of scientific understanding that flows into government decisions relating to COVID. Now, the government makes it clear that ministers are not beholden to what SAGE says, and that SAGE advice does not represent official government policy. Nonetheless, SAGE is in a position of great influence as the body responsible for framing the problems and presenting policy options. So, in the first part of this talk, I try to show how SAGE uses this position to advocate for a particular kind of response to COVID, and I argue that this is an improper use of expertise given the trade-offs involved in policies such as lockdown and the range of competing values that must be accounted for. I suggest that we should want SAGE to act more like an honest broker with a commitment to expanding or at least clarifying the scope of choice available to decision makers. In the second part, I show how the various sources of uncertainty involved in COVID-19 can make it difficult for SAGE to expand the scope of choice without compromising the utility and intelligibility of its advice. And I argue that non-epistemic value judgments form an unavoidable part of this process. Finally, I consider the argument that greater transparency might mitigate some concerns about the value-ladenness of SAGE advice. I argue that transparency is not a fix on its own and suggest that it could be exploited to generate mistrust in scientific expertise. Nonetheless, I conclude that SAGE should still be more open about its value commitments in order to foster a better atmosphere for good faith debates about trade-offs in COVID-19 policies. So, before I make any normative claims about SAGE, it's worth establishing a basic premise, which is central to the argument of my paper. In situations where values are in dispute, we should want expert advice which caters to a variety of value commitments, not just one side of the debate. Now, this much I hope is relatively uncontroversial. Rather than by this premise in general terms, I'm going to show how it holds true in the context of COVID. Now, everyone would no doubt agree that ending the pandemic is a goal of immense importance. However, as we all know, it's far from clear that ending the pandemic should be our only goal. Obviously, policies for halting the spread of COVID, such as significant trade-offs, requiring the careful weighing of various values against each other. By, for example, shutting down the economy and instructing people to stay at home, decision makers create a new set of problems that need solving: job loss, damage to mental health, disruption to education, and so on. It can be difficult to account for these costs now when their effects will be felt most acutely in the future, but this, of course, doesn't negate their significance. The costs are also unevenly distributed throughout society, such that young people appear to be sacrificing more to suppress a virus which they are at less risk of dying from. Other axes of inequality matter too. For example, lockdown measures disproportionately affect the poorest people, who are less likely to be able to sustain themselves when their income streams and support networks are taken away. With so many trade-offs at stake, one would hope that COVID policy advice would reflect the range of value judgments that could be made. However, SAGE's approach has been to focus primarily on preventing deaths in the short term due to COVID-19 and to offer policy options geared towards this objective above all others. Now, I won't attempt to offer an exhaustive overview of the ways in which SAGE's advice has reflected this commitment, as my intention has been for this paper to be primarily normative rather than descriptive, but my claim does need some contextualizing. Now, a particularly illustrative example can be found in SAGE's response to the rise in COVID-19 cases after the summer, a development which sparked fears of a second wave of the virus. As with the first wave in the spring, there was concern that the NHS could quickly become overwhelmed, leading to thousands of deaths. A SAGE paper dated to the 21st of September of 2020 proposed a selection of non-pharmaceutical interventions, the first of which was a 2-week circuit breaker lockdown to be imposed with immediate effect. Now, what's striking about this paper is that the situation is framed in such a way that ministers seem to have an urgent obligation to pursue these measures, because the alternative is depicted as unthinkable. The paper begins with the emotive statement that, quote, "not acting now to reduce cases will result in a very large epidemic with catastrophic consequences." Another bullet point reads, "a package of interventions will need to be adopted to prevent this exponential rise in cases." Of course, in scientific advice, the choice of wording matters. Being told that you need to do something in order to avert a catastrophe is hardly going to help you weigh up your options in a clear-headed manner. Though the government initially held off on implementing SAGE's recommendations, the announcement of a 4-week lockdown at the start of November can be seen as an eventual concession to the same arguments made by SAGE in mid-September. At this point, one might reasonably ask what SAGE has actually done wrong here. Although the paper is clearly phrased in a way which urges immediate drastic action in a particular manner deemed most necessary by SAGE, the purpose of this action is to save lives. Who could find fault in that? Yet, as I have argued, there are numerous other considerations to be made. Lockdowns save lives, but they of course cost lives too. Although there are clearly compelling arguments for a lockdown when faced with rapidly rising COVID cases, these arguments are not self-evident, and people will reasonably differ on how they weigh up the costs and benefits involved. The SAGE paper does acknowledge that the proposed interventions, quote, "have associated costs in terms of health and well-being, and that measures will be needed to mitigate these effects." But the assumption here is that lockdown is strictly necessary and that we will simply have to deal with the costs as best we can. Given the lack of consensus on values in the COVID response, I argue that the best approach for SAGE would be to act as an honest broker of policy alternatives. This term, first introduced by Roger Pielke, denotes a scientist, although it can just as easily refer to a committee or other formal organization, who aims to clarify and, where possible, expand the scope of choice available to decision makers in a way that allows them to subsequently reduce choice based on their own preferences. When values are in dispute, appeals to scientific evidence can only achieve so much. Resolving conflicting interests is the job of politicians, not scientific experts. What experts can usefully contribute is the invention of new and innovative policy options, which can, as Pielke puts it, change political calculations and motivate new coalitions and thus opportunities for political compromise and policy action. This can help decision makers to avoid getting stuck in restrictive binaries, as has sometimes been the case in debates centered around lockdown. What is SAGE then, if not an honest broker? The alternative, as defined by Pielke, is an issue advocate. Someone who tries to limit the scope of choice by encouraging a particular course of action, which they themselves believe, for whatever reason, to be the best one. Now, it might seem somewhat unfair to label SAGE an issue advocate when the issue is preventing COVID deaths. This is a universally agreed upon good, not a political agenda with interest groups lobbying SAGE for its advancement. Nonetheless, given that so many other issues are at stake, SAGE's reduction of the scope of choice in favor of a single issue is problematic. It appears that SAGE could be influenced by what Peter Singer and Michael Plant have called an identified cause effect, leading to a focus on a specific known source of suffering at the expense of other less easily identifiable ones. Now, in a sense, this is unsurprising. An expert body which skews towards epidemiologists and clinicians will tend to emphasize the prevention of deaths due to disease over other causes that might arise from lockdown measures, given that disease is the subject of their expertise and its avoidance is their primary social responsibility. An epidemiologist will probably be quite reluctant, understandably, to even offer an option which involves widespread transmission of a virus through a population. These considerations point towards the need for so that the scope of choice is not just reflective of the priorities of medical experts. Alfred Moore and Michael Mackenzie have suggested that in addition to the likes of virologists and epidemiologists, we should also be more frequently consulting other kinds of experts, such as economists, psychologists, sociologists, educators, and child welfare advocates. This might seem like a separate consideration with little bearing on SAGE, an advisory group which is explicitly scientific in its remit. And to be clear, I'm not calling for SAGE to be stuffed full of sociologists. It's already a large and diverse expert body, and the inclusion of numerous non-scientific experts might risk confusing the remit of the group. What I am suggesting is a broadening of the kind of evidence that SAGE considers, and greater dialogue between scientists and those with other kinds of relevant expertise at the stage before advice is given. This would hopefully make it easier for SAGE to offer a wider range of options, allowing the scientists to account for values and trade-offs that they might not have fully considered or appreciated on their own. I've argued so far that the kind of ethical trade-offs involved in COVID policies mean that SAGE has a responsibility to expand the scope of choice for decision makers in order to reflect the lack of public consensus on how to value the various costs and benefits at stake. SAGE doesn't currently do this to a sufficient extent in the short term, and presenting these, one solution to this would be a diversification of expertise in COVID policy, so there are a wider range of values are taken into account, and SAGE is better equipped to be an honest broker. Now, this might be a satisfactory analysis if the only problem was disagreement about what ought to be done in response to COVID in terms of preferred outcomes. The issue, however, runs deeper than this, because there is also immense uncertainty about the actual effects of different potential interventions, partly due to their inherent complexity and partly owing to a basic lack of understanding about the novel coronavirus itself. Experts have had to contend what role asymptomatic infections play in transmission, the duration of immunity after infection, and numerous other key considerations. With the emergence of the virus still so recent, there hasn't yet been the opportunity for a mature, well-ordered scientific community around COVID to establish itself. This stands in contrast to other crises such as climate change, which, despite pervasive uncertainty, nonetheless rest on a scientific consensus that's well established from numerous distinct disciplines. What all of this means is that experts have repeatedly made assumptions based on incomplete or poor quality data, with the consequence that the scope of choice is reduced in ways that may be very difficult to detect and avoid. As with the previous section, I will aim to demonstrate this by means of a representative example. So it is by now a widely repeated claim that the government was too slow in its decision to announce a national lockdown on the 23rd of March, and that the number of deaths could have been halved had lockdown been imposed a week earlier. Accordingly, various attempts have been made to figure out how the delay in this decision came about. So leaving aside the question of whether lockdown is the right approach to begin with, based on these previous discussions of trade-offs, studies of the decision-making process behind the March lockdown point towards some possibly more significant problems for any aspirations we might have of turning SAGE into a full-fledged honest broker. So Warren Pearce has argued that a major factor contributing to the lateness of the UK lockdown is SAGE's downplaying of uncertainties and models of the virus and its doubling rate. In his paper, Pearce shows how epidemiologists acted both as knowledge producers, constructing the models, and as knowledge users, giving scientific advice, a conflation of roles which he argues led to them inaccurately depicting the uncertainty within their own models. SAGE drew on the work of two teams of modelers in particular, one at Imperial College London and the other at the London School of Hygiene and Tropical Medicine. These modelers produced estimates of the R rate, which varied significantly. The Imperial College team placed the number between 2.0 and 2.6, with a central estimate of 2.4, while the School of Hygiene and Tropical Medicine gave an estimate of 2.7, but stated that it could be as high as 3.9. So this substantial uncertainty and disunity did not translate into the advice given by SAGE. The focus was on a single value for the doubling rate of the virus, with repeated claims both in public and in SAGE minutes that the virus was doubling every 5 days or so. Had the uncertainty of the doubling rate been made more explicit, ministers might not have been so complacent and lockdown might have been given serious consideration early on. In another paper, Lawrence Friedman discusses the impact of assumptions around public behavior and compliance on the decision to hold off on lockdown until the 23rd of March. SAGE identified the choice of whether to start with the harshest measures and then repeal them where possible, or to add measures step by step where required as a, quote, political decision. And yet a subsequent SAGE paper committed itself to arguing for the latter graduated approach. It appears that this was motivated by concerns about the amount of time that the public would be willing to tolerate dramatic impositions on their lives. If lockdown measures were going to last a while, the worry was that the most stringent measures shouldn't come into play too early, or else the public might tire of them and fail to comply just as the virus was reaching its peak and suppression was most essential. This concept, labelled by some as behavioural fatigue, had a lack of clear evidential support, and yet it was the basis for a narrowing of the scope of choice to favour a gradual later lockdown. Both of these examples point towards a further difficulty for SAGE to resolve if it is to be an honest broker. At various points in the advisory process, SAGE experts are confronted with uncertainty. In this case, uncertainty about the true doubling rate of the virus, or uncertainty about the public response to potential interventions. Two kinds of approach seem possible: report the full extent of this uncertainty and leave any assessment up to the policymakers, or attempt to resolve the uncertainty and express some sort of consensus when giving advice. For example, the doubling rate of the virus is around 5 days, or lockdown shouldn't start too soon in order to avoid behavioural fatigue. Obviously, neither option is especially appealing when taken to the extreme. If SAGE were to express all the uncertainty underlying its predictions and recommendations, ministers would be swamped with information and might struggle to make sense of their options. Recall that it is SAGE's job to provide coherent, coordinated advice and to interpret complex or uncertain scientific evidence in non-technical language. So some amount of interpretation is needed, because after all, experts are sought out for the purpose of helping us figure out what to do, not merely to describe a state of affairs. Yet, if this is taken too far, the experts can end up steering the choice in a particular direction, as was the case in the previous examples I've given. Advice which includes an array of options can only offer limited freedom in practice if these options are all informed by a single value for the doubling rate or a fixed assumption about public behavioural tendencies. So the advisor looks like an honest broker, but in reality, the scope of choice is still being reduced, just at a deeper level. In some cases, it looks as though SAGE may have no choice but to opt for the latter approach. This becomes apparent when we consider the epidemiological models themselves. Take, for example, the Imperial College model that was so pivotal in the decision to go into lockdown on the 23rd of March. The function of this model was to predict how various policy choices would impact hospital bed and intensive care unit demand, meaning it needed inputs for the expected death rate, hospitalization rate, and ICU admittance rate for each 100,000 people infected. In total, almost 700 different parameters went into the construction of this model. These parameters were not well understood at the time, and their selection involved extensive guesswork. Given the paucity of good quality data, non-epistemic values must have played a significant role in the choices behind how to set the various parameters in this model. These are, in effect, judgments of inductive risk. If different parameter choices could lead to overestimation or underestimation of COVID deaths, and the choice between them is undetermined by the empirical data, the decision becomes one of whether you are willing to risk predicting too many deaths or too few. This seems like a value judgment that should be left to elected officials rather than scientific experts, but it's unclear what the modelers could do to avoid it. Repeatedly running the model while varying the parameters to see how results change just wouldn't be a feasible option, given that a single run of the imperial model required around 20,000 processor hours. So where does this leave us? There have been suggestions that the solution to this, and to the related set of concerns that I've raised in this talk, would involve greater transparency. John Dupre has argued for the importance of decisions being made in an open and openly accountable way, stressing that we should want to see how various perspectives and considerations have been weighed against each other. Addressing data and measurement specifically, Stefano Canali argued that we need to make sure that the collection, manipulation, and use of data is well documented and open to other researchers and the public, because assumptions and values come into play both at the point where we collect data as well as when we apply policies. So the argument, I take it, is that if non-epistemic value inputs are an inevitable part of useful and comprehensible policy advice, then the public should at least be aware of what those values are. I am sympathetic to this argument, although it's by no means a solution in and of itself. Transparency is of little help if the public can't actually do anything about the changes being made to their lives. It's unclear to me what the average member of public stands to gain just from knowing the value judgments made by epidemiologists and ministers in the decision to impose a lockdown, the freedoms of the public are still curtailed. They're just being told why other people thought this was the right decision. Transparency is, at the very least, a starting point, however. If people are unsatisfied with the ways that experts and policymakers have traded off values, they can petition the government to take a different approach and give greater consideration to values that might not have found their way into the decision-making process. Whether the right frameworks exist for these kinds of public inputs to actually affect change in policy is, of course, another matter. And I suppose this kind of links to what Jonathan was talking about at the start of the day, about the need for some kind of participatory process for citizen inputs. SAGE does already practice a modest amount of transparency, though this only came about in response to sustained pressure and criticism. It's standard government policy for membership and minutes of SAGE to be kept secret until after the emergency that SAGE was activated to advise on, but an exception was made for the current session given the, quote, extraordinary and extended nature of the COVID-19 outbreak. A full list of members was published on the 4th of May, and the evidence considered by SAGE is now made publicly available once it's no longer under live consideration for policy decisions. This transparency is of a limited nature, however. Looking through the minutes of past SAGE meetings, you won't find any mention of inductive risk or the influence of non-epistemic values on model construction. Now, in the full version of this paper, I go on to talk about some worries about transparency and mistrust in scientific advice and agnotology, but I will hold fire on this because I see we're running a little bit low on time and I want to leave some time for questions. So I will just get to some concluding thoughts. So my argument throughout this talk has been that scientific advice on COVID should offer a broad range of options to reflect the diverse value considerations involved, and that SAGE hasn't done enough to widen the scope of choice in this way. Some of the issues I've identified appear relatively tractable. If a committee of experts tend to favour interventions which reduce COVID deaths at the expense of deaths due to other causes, this committee should probably receive more inputs from experts in other fields, which give greater consideration to concerns beyond the prevention of disease. Other issues do look far trickier. With so much uncertainty involved in the science of COVID-19, it seems that experts sometimes have no choice but to influence the decision-making process with their value judgments by solving problems of inductive risk. The alternative, presenting raw data and leaving all the interpretation up to policymakers, would be a dereliction of their duty as advisors. This should, of course, serve as a reminder that the role of honest broker is an idealization rather than a perfect guideline for practice, and that the worthwhile norm of expanding the scope of choice is not an end in of itself which trumps all others. So if COVID advice must be at some level value-laden and experts can only do their job by sometimes reducing the scope of choice in ways that reflect their own non-epistemic values, where does this leave us? I would suggest that greater transparency about these values is a good start because citizens need to at least know how values are being traded off in the first place if they want to call for a COVID response, which weighs these values differently. People who have thus far accepted the advice of SAGE due to its scientific authority might not even fully realise there are other legitimate ways to resolve the various value disputes underlying COVID policy. Until SAGE is more explicit about its value commitments, it will continue to be easy for people to perceive debates over COVID policy in unhelpfully polarised terms of science versus politics, where the science offers uncomfortable truths and the politicians are sometimes unwilling to make the necessary sacrifices. If we do want a COVID response which takes seriously the values of all stakeholders, the scientific advice needs to acknowledge that trade-offs based on non-epistemic values are an integral component and that none of them can be taken for granted. Thank you.